Thank you, everyone. My name is Kristan. I'm Program Manager at the ARDC, and for the last 3 years have been managing the HeSANDA program. It's my pleasure to be visiting the home of the Yagara and Turrbal people. I'm visiting from Ngunnawal Territory, which is currently the home of Canberra, Australia's capital city. Okay. So I've got a bit of a gear change in proceedings. If I'd thought about it, I would have ordered my slides a little bit differently. We've been hearing a lot about big picture and not just national but international directions. I'm going to bring it down in the first part of my talk to something more specific that we've been doing here in Australia, and importantly in partnership with Health Translation Queensland. But just as a quick context setting, I will go on about later about what we're doing more broadly in Australia. But to give an idea of who ARDC is, we heard from Andrew about national scale initiatives, and in ARDC that's exactly what we do. We're established under the Australian Government's NCRIS program, and we're one of a family of organisations whose purpose is to establish and operate research infrastructure that is national in scale. So national in scale larger than what a single institution or jurisdiction could operate, but infrastructure that's built for the benefit of institutions and their researchers and is developed and operated in partnership with them. So in some respects, we act as a coordinating layer across the national research sector. Within that family of organisations, ARDC provides research data infrastructure to Australia. And we do that via a diverse portfolio of products and services. So we operate Nectar, for example, which is Australia's research cloud. We have partnerships to develop national data assets, platforms and software, as well as investing in workforce development and data policy development. So, as I said, in the last 3 years, we've been running the HeSANDA program. It's one of our major investments up to this point into digital infrastructure for health research. We heard from John about the importance of data sharing, from Andrew about the value of national scale initiatives. And those principles and ARDC's role as that national coordinating body form the basis of this major project. As we'll see a bit later, the first 3 years has been just an initial step in building national scale infrastructure for Australia. And it's resulted in a platform to facilitate the sharing of clinical trials data for secondary research. And that platform is called Health Data Australia. So, and this is what I meant by gear change. Actually, just going to jump straight into the product or platform and show you that. I'll come back to the details of the initiative a bit later. So also I'm going to do this via screenshots because there's no chance I'm risking another tech mishap of a live website demonstration. So this is the front page of Health Data Australia. So as a researcher, I come to this data catalogue, I enter a simple keyword search, and that takes me to a list of categorized search results. So each listing here is a data set from a clinical trial. There's about 117 odd trials in there at the moment. We launched about 2 or 3 months ago, so that's okay for a starting point. This is going to grow over time, and it's going to go beyond clinical trials as well. So we're currently looking to expand into cohort studies, clinical registries, government data, health service data, really blowing up the scope here. If I'm a researcher and I click into one of these search results, I see a detailed description of that data set. And so I pretend that I'm scrolling down the page. I see related information. So the funders of that data, the researchers and organisations associated with the data, the publications associated with that data. Scrolling down a little bit further, I see a persistent identifier for the data set that allows anyone to really track its use across the research ecosystem. And we'll also see information about the trial that has produced the data set, and we draw this from ANZ CTR, which is our National Clinical Trials Registry. In that information, we also see the data access conditions as registered with ANZ CTR, and we can find links to the study protocol and data dictionary. So I'm a researcher, I'm going through the catalogue, I see, well, this is actually something that could be useful for my research. I can click on the access the data button, and I can log in. I won't go into the details of logging in, that seems a bit dry. And then I'm taken to a standardized data request form. So anyone that's worked in this space knows the concept, but this one, I provide my details, who I am, who my team is, some basic information about the project that I am running or want to run, provide information about the scientific rationale for my project and the design of my research, but also what the planned outputs of that research are. Is it research articles, a student thesis, conference, presentations, and so on. And I also provide information about what ethics approval I have in place and supporting documentation, and click submit. So when I click submit, that request is then going to go back to the primary researcher or their delegated data custodian. I'll go into this in a bit more detail soon, but ARDC is not going to hold or review access to your data. That's not our role. As that primary researcher or data custodian, I get a notification saying you've got a new data request. I've got my own dashboard that I can log into and see all my requests that are currently in the pipeline. If I click into one of those, sorry, very small text, but hopefully you get the idea. I see the details of the request, and then actually the information that the requester provided in that form we were looking at a moment ago, it's all going to get converted into a PDF, so that if there's a scientific committee, advisory committee, someone that needs to see that request, that's very easy then to forward off to them. So the point here, and that's why the small text, not such a big issue, the point here is that we have a common framework for trialists to respond to data requests. It's a flexible workflow that we use. It allows custodians to apply their own governance policies, to ask for more information from the requester, and then they approve or reject the request as they deem appropriate. Again, just to emphasize, this platform and ARDC isn't going to replace or dictate a trial's governance or data access arrangements. That's for each individual trial or custodian to determine. What we've done is establish this common framework to allow people to respond to requests and allows the requester and custodian to track the progress of all their requests in one place. How does it work? Going to keep this brief and not technical, but a key message for trialists who want to expand that collaborative network, interested in the things that John and Andrew were speaking about, but have concerns about some of the implications of data sharing. So the key thing here, as I said before, the data stays within your control and it's not housed within the HCA platform. Your governance policies and procedures are also your own, and the platform doesn't. The platform is there just to help you respond to data requests and complement your governance, not to tell you how to do your governance. So what the platform does require is this metadata. So the descriptions of your governance, the descriptions of your data, and not the sensitive stuff, which always stays with you. But to help researchers find you and find your data, we need those descriptions in HDA, and you do that by contacting your local node. We're going to hear about the HTQ node shortly. We have a network of 9 nodes around Australia, and they're really the key operational units that connect trialists to the platform. Each node operates a little differently, and that's so they can be set up in a way that best supports their specific partners. In a few minutes, we're going to hear from Kathy, who will explain how the Queensland node is going to work for organisations in Queensland. So anyway, once we have that connection with your node, A researcher can then come to the HCA platform, search the catalogue and submit a request to see the data itself. As we saw before, that request is going to get sent back to the trialist, and that trialist reviews it against their specific requirements. If it meets those requirements, then arrangements are made directly with the researcher for them to have access to the data. Okay, so that's the platform. Now let's go quickly about how this fits into that bigger picture and ecosystem that John and Andrew were speaking about. Noting that this was a massive collaborative effort, and I've just shown you the platform. There are a whole bunch of other resources and complementary components of this that there's not enough time today to go into. But I'll talk about how we got to this point. So being a major national scale initiative, the project was guided by a committee of peak national research bodies, including the government, clinical trials networks, consumers, and ARA, the organisation representing health research translation centres like Health Translation Queensland. Under the guidance of that advisory committee, we began public consultations in 2020. The purpose here was to really, that whole idea of interoperability, we started with what the end outcome needed to be. So what did researchers actually want to do? What kinds of research did they want to do? Start there and work backwards little step by little step. So there were over 200 people involved in that undertaking. We were assisted by an editorial team drawn from the community, as well as AHW and ACTA. And after that initial phase of consultation, and getting those requirements and those endpoints and that value proposition for researchers, we then started co-designing a solution that could hopefully start to meet those requirements. Co-design because at this stage we had about 100 people with relevant expertise contributing to a series of working groups. The majority of these people were drawn from our 9 HeSANDA nodes, and now we move into HeSANDA's vanity metrics here. So our network that we've been building over the last 3 years is a network of over 70 universities, institutes, trial networks, and other organisations. As I said, those 70 plus organisations grouped into 9 nodes, spread around Australia, 7 of which provide regional coverage, like the Health Translation Queensland node, and other 2 nodes have specialisations, one in cancer trials and the other in mental health trials. We got through that design stage. We then started on the build stage with the nodes that allowed them to establish the policies and procedures to allow data sharing to become a new normal for clinical trials in Australia. And the nodes have been working tirelessly to onboard existing trials. This is a system that the Australian research community has built together. Hopefully the last few slides give an indication of that, to meet a collective need. And I really hope that the people from Queensland joining us today will get on board and not to be competitive, but make Queensland the leading node in Australia. We don't have time, we'll go back. As I said, today I focus on the program, on the platform, but it's worth noting all the other outcomes of this project. As Andrew was alluding to, it's not just about the technology. There's a whole bunch of procedures, policies, a whole bunch of culture change that needs to happen. So a busy slide, but really the program has been approaching this in a holistic fashion, and has got runs on the board already. Also, just to acknowledge some of the other partners in the development phase. So ANZ CTR, a group called HTQ, who developed a consent template to help trialists get patient consent to share data. And of course, ACTA, who we've been engaged with throughout. That was a whirlwind. I'm just going to give you a quick overview of what's coming next. It was a first step in Australia. We're about 5 years, I think, behind HDR UK. We're about £260 million short of HDR UK. But that's not going to stop us. So building on the success of this initial Pathfinder project, we're expanding the scope of work. We've established a new 5-year health and medical portfolio called People Research Data Commons. And HeSANDA and the network that we've established is going to be a central component of that. So just quick summary. In the People RDC, we'll be building on partnerships across sector, government, health service, industry, as well as with research institutions. We'll be looking to address in those projects the top priorities of the health and medical sector, those digital challenges that we've heard about today and that we've heard in our own consultations. So the need for enduring national data assets, secure access to sensitive data, to have data integrated from a range of sources to allow for more powerful, more insightful research, like we just heard about at the end of Andrew's speech, and access to cutting-edge analytical tools like AI and machine learning. And from these partnerships, we'll grow this collection of national infrastructure. So not just the technical components, but the data assets, data standards, capabilities of Australian health researchers. Thanks for your time.